Hello everyone. Here are the questions of midwifery from 2016 to 2020. I will discuss only short questions. Number 5, fill in the blank. Ovulation occurs 14 days before the next menstruation. There are 4 number of pelvic bones. If pregnancy occurs in fallopian tube, it is called tubal pregnancy or ectopic pregnancy. Use of condom prevent AIDS disease. Umbilical cord has 2 artery, 1 veins. Next, true false. Anterior fontanelle closes in 18-week, true. MTV Act is launched in 1975, false. 1971. Low birth weight baby is less than 2.5 kg, true. Postnatal mother should take adequate water, true. High blood pressure in pregnancy is a sign of hyperemesis gravidarum, false. Next, full form. COC, combined oral contraceptive pill. PPH, postpartum hemorrhage. ARM, artificial rupture of membrane. CPD, cephalopelvic disproportion. MMR, mumps, measles, rubella. Again, same question repeated. Ovulation occurs 14 days prior to menstruation. Perception of active fetal movement by mother is called quickening. Ask the antenatal mother to empty her bladder for an abdominal examination. The maintenance dose of MgSO4 in eclampsia is 5 grams intramuscular every 4 hourly. The most suitable pelvis for normal delivery is gynecoid pelvis. True false. The duration of third stage of labor in priming gravida is 1 hour. False. Umbilical cord has 2 veins, 1 artery, false. Abortion is the expulsion of fetus before the period of viability, true. Hemoglobin should be tested at every visit for a pregnant woman, true. Folic acid is given to the antenatal mother to prevent bleeding, false. Full form PPIUCD, postpartum intrauterine contraceptive device, CCT, control cord traction, BFHI, baby friendly hospital initiative, LSCS, lower segment cesarean section, IVF, in vitro fertilization, RVF, retrovaginal fistula, CPD, cephalopelvic disproportion, ECP, emergency contraceptive pill, PPH, postpartum hemorrhage, STD, sexual transmitted disease. When the duration of first stage of labor is more than 20 hours is called prolonged labor. The fertilized ovum implants outside of the uterus is known as ectopic pregnancy. Isthmus is a part of uterus. Perception of active fetal movement by mother is quickening. Repeated question. Overlapping of bones in fetal skull during birth is called molding. True false. Ovulation occurs 14 days prior to menstruation. True. Again, repeated question. Anterior fontanelle is also called lambda. Wrong. It is called bregma. Umbilical cord has 2 artery, 1 vein. True. Repeated questions. Obstetrical emergency is hyperemesis gravidarum. Wrong. Membrane space which separate fetal skull bones is called suture. True. Average amount of amniotic fluid is 500 to 1500. True. Normal heart rate of newborn is 160 to 180. True. Endometrium of the pregnant uterus is torn as morula. False. Nurses assist postpartum hemorrhage checking mother's pad. True. Embryo is developing offspring till 6 weeks of implantation. True. VE, vaginal examination. VVF, vesico-vaginal fistula. PID, pelvic inflammatory disease. IUGR, intrauterine growth retardation. HBV, hepatitis B virus. IVF, in vitro fertilization. Repeated question. CPD, cephalopelvic disproportion. IGNWPS, Indira Gandhi National Widow Pension Scheme. MVE, I could not found. ART, antiretroviral therapy. When should you preferably count the FHR? Just before a uterine contraction. Which of the following is an indicator that needs referral to an FRU? Meconium stain liquor. The expected date of delivery can be calculated by LMP 9 month plus 7 days. The supplement that helps in reducing the incidence of neural tube defect in the fetus is folic acid. The normal body temperature of a newborn baby is 36 to 36.5 degrees Celsius. What is the maintenance dose of magnesium sulfate in eclampsia? 5 grams IM every 4 hourly. While preparing for an abdominal examination, ask the antenatal mother to empty bladder. Repeated questions. Fetal heart start beating during fetal development period of after 4 weeks. Cervix is considered fully dilated when it is 10 centimeter dilated. One of the following is malpresentation, that is breech. Caput succedaneum disappears within 24 to 48 hours. Endometrium of pregnant uterus is torn as decidua. A fully dilated cervix is 10 centimeter in diameter. Repeated questions. Pap smear for detection of cervical cancer. Pregnancy occurs other than the uterus is known as ectopic pregnancy. Repeated question. Oxytocin is true false. Oxytocin is used to induce labor pain. Umbilical cord consists of two veins, one artery. False. Repeated question. Transverse lie is commonly associated with obstructed labor. True. Foul smelling lochia is not a typical finding for puerperal sepsis. False. If a woman is HIV positive, all her babies would be HIV positive as they share the same blood. True. Cord prolapse is an obstetrical emergency. True. Hemoglobin should be tested at every visit for a pregnant woman. True. Perception of fetal movement is called lightening. False. Isthmus is a part of uterus. True. Repeated question. Molding disappears after delivery. True. ROM, rupture of membrane, LSCS, lower segment, cesarean section, CCT, control contraction, MTP, medical termination of pregnancy, MCTS, mother and child tracking system, VCTC, voluntary counseling, testing center, PPIUCD, postpartum intrauterine contraceptive device, AMTSL, active management of third stage of labor, BEOC, basic emergency obstetric care, WIFS, weekly iron and folic acid supplementation. All these are the repeated question. Next, column matching, shortening and thinning of cervix, cervical effacement, dystocia, difficult labor, infertility, obesity, AIDS, ELISA test, pelvic reef, 4 number, abortion after 4 week of pregnancy, fetal heartbeat is the after 4 week of pregnancy, abortion, craniotomy is the destructive surgery, and abortion is 10 week of pregnancy. Head arrest is forceps delivery. ART, antiretroviral therapy, FRU, first referral unit, KMC, kangaroo mother care, AVF, exclusive breastfeeding, BFHI, baby friendly hospital initiative, IFA, iron and folic acid, AMTSL, active management of third stage of labor, repeated question, ICTC, integrated counseling and testing center, PROM, premature rupture of membrane, CPD, cephalopelvic disproportion. All are repeated questions. Fill in the blanks. Ovulation occur after 14 days of menstruation. Continuously repeated question. Use of condom prevent HIV/AIDS. Fundal height at the level of umbilicus indicate 20 week of pregnancy. Patograph is used at the time of labor. Normal heart rate of newborn is 120 to 160 beat per minute. First fetal movement felt by mother is called pantograph. False. High blood pressure in pregnancy is a sign of hyperemesis gravidarum. False. The most suitable pelvis for normal delivery is gynecoid pelvis. True. Normal quantity of amniotic fluid is 1500 ml. True. Umbilical cord have two veins, one artery. False. Repeated question. Then column match. Regular contraction is true pain. Placenta previa is the painless uterine bleeding. Meconium stain. Fetal distress. Craniotomy, dead fetus. Anemia, IFA tablet. Biparatal diameter 9.5 cm. Oligohydramnios less than 300 ml. Hypothermia. Hypothermia, fetal distress. Ectopic pregnancy, acute abdominal pain, short height, high risk pregnancy, breastfeeding, natural method of family planning, enlarged abdomen, polyhydramnios, placenta previa, painless bleeding, itching of vulva, reproductive tract infection, ovulation, 14 days of menstruation, placenta separation, third stage of labor. CCT, control contraction, ECP, emergency contraceptive pill, STD, sexual transmitted disease, PPH, postpartum hem, IUGR, intrauterine growth retardation. Thank you.